Contact tracing is the process of interviewing people with COVID-19 to determine who they have been in contact with during their incubation period and their infectious period. This is to determine who they may have potentially spread the virus to, as well as who they may have got the virus from. A risk assessment occurs for each case. The people determined to be at risk are advised by health authorities to go into quarantine if it is less than 14 days from their last exposure to the case. Some people may be advised to have a test to see if they have COVID-19. In South Australia, this process is undertaken by public health officers, nurses and doctors from the Communicable Disease Control Branch of SA Health. Contact tracing is really important as it means that we identify people who could potentially become unwell with COVID-19 and spread the infection further. By asking these people to stay home for 14 days, we help limit the spread in the community. It also helps us identify new cases. CDCB has been engaged in a lot of active case finding where we do more investigative work in special circumstances to find out if anyone else has been unwell. By proactively identifying people who are cases and getting them tested, we are able to further limit the spread of the disease.
Contact tracing begins with a notification to CDCB. We work closely with SA Pathology and interstate laboratories to ensure we are told about any COVID positive cases as soon as they have been processed. Contact tracing is time critical for it to be beneficial, so we try to contact someone within a few hours of finding out they are positive, if not immediately. A public health officer or nurse will speak with them to find out about their illness and when it began, identifying the days they would have been infectious. We then collect a day-by-day history in great detail of everything that person has done. Some interviews can take well over an hour to get sufficient information. It's vital that we get accurate information from each case to enable further contact tracing. The public health officer or nurse will then discuss the findings from the interview with a public health doctor or senior public health officer, and together a risk assessment will be made. Through this process, the team members will decide who needs to be contacted, including those who need to be quarantined and other situations where we require more information. A team of public health officers then phones each person and provides some health information specific to their circumstance, and in a lot of cases, will direct them to quarantine for 14 days since their exposure. We encourage the active participation of cases in the contact tracing process, for example, letting their family and friends know to expect our call. However, we always treat each case with a high level of sensitivity and try our best to keep their identity confidential when speaking with their contacts. Each close contact receives a letter with information about the process. They also receive a daily SMS or phone call to find out if they have developed any symptoms, meaning we are able to detect new cases rapidly by arranging testing as soon as possible if any contacts become unwell. A close contact is defined as someone who spends more than 15 minutes of face-to-face contact within 1.5 metres while the person was infectious with COVID-19. However, this is a very black and white rule and doesn't always reflect real life. Other considerations are if cases have been with others in a closed room, such as a meeting room, for over 2 hours, or 2 rows in front of or behind an infectious case on an aeroplane. Sometimes there are no clear rules on who is or is not a close contact, and we rely on the expertise of our public health and infectious disease specialist doctors to assist with making these decisions on a case-by-case basis to ensure all possible contacts are traced and informed.
Contact tracing is one of the most important tools we have in the fight against COVID-19. In South Australia, nearly a third of COVID-19 cases have been a close contact of a confirmed case. For most of these cases, we would have identified them through the contact tracing process and identified them as needing to isolate to stop further spread. Without contact tracing, these people may not have known they were contacts of a case, how long to stay isolated for, or even anything about COVID-19, and could have unknowingly continued to spread COVID-19 in the community.
The new contact tracing app, COVID Safe, will help the health system identify COVID-19 cases and know who they have been in contact with to enable an easy contact tracing process. The app helps find close contacts of COVID-19 cases. This will help us quickly contact people who may have been exposed to COVID-19. The app speeds up the current manual process of finding people who have been in close contact with someone with COVID-19. This means you'll be contacted more quickly if you're at risk. This reduces the chances of you passing on the virus to your family, friends, and other people in the community. CDCB can only access app information if someone tests positive and agrees to their information in their phone being uploaded. We can only use the app information to help alert those who may need to quarantine or get tested. The more people that download the app, the more effective it will be in our fight against COVID-19.